The carpal tunnel is formed by an arch-shaped row of carpal bones on the bottom, and the roof is formed by the transverse carpal ligament. 9 flexor tendons run within the carpal tunnel along with the median nerve. The space inside the tunnel may be reduced due to pathology causing compression of the median nerve, which could give rise to complaints. In order to decompress the median nerve, the transverse ligament can be transected. The radius is the most lateral lying bone of the forearm, and the ulnar is the most medial lying bone of the forearm when it is in supinated position. The most radially located bones of the proximal and distal row of carpal bones are the scaphoid and the trapezium bones respectively. The most medially located bones of the proximal and distal row of carpal bones are the pisiform and the hamate bone respectively. Furthermore, metacarpal bones 1 to 5 are shown in this overview, and counting of the bones starts at the thumb. The corresponding phalanges are also identified and are counted in a similar sequence. The transverse carpal ligament is a fibrous band located on the ventral side of the wrist. On the radial side, it attaches to the scaphoid tubercle and the ridge of the trapezium bone. On the ulnar side, it attaches to the pisiform bone and the hook of the hamate bone. The transverse ligament forms the roof of the carpal tunnel, whilst the bottom is formed by the carpal bones. This ligament is transected when performing a carpal tunnel release. The palmar fascia is a thin, superficial sheath of fibrous tissue located on the volar side of the hand. It encloses muscles, tendons, and neurovascular bundles. There are 4 deep flexor tendons of the fingers, each arising from the flexor digitorum profundus muscle, and 4 superficial flexor tendons of the fingers, each arising from the flexor digitorum superficialis muscle, all running through the carpal tunnel. Similarly, the flexor pollicis longus tendon also runs within the canal. Digital flexion is performed through these tendons and corresponding muscles. Superficially, the long palmar muscle, not visible in this overview, is connected to the palmar fascia by the long palmar tendon. Take note that this muscle and tendon is not anatomically found in some humans. Both the superficial and cutaneous branches of the radial nerve run over the dorso-radial side of the wrist and hand, outside of the carpal tunnel. The median nerve runs through the carpal tunnel along with the 9 flexor tendons previously seen. Compression of this nerve occurs when the space inside the tunnel is reduced, a condition known as the carpal tunnel syndrome. The superficial and cutaneous branches of the ulnar nerve run over the ulnar volar side of the wrist and hand outside of the carpal tunnel. The radial artery arises from the brachial artery. More distally, it is located on the radial volar side of the forearm and wrist. The ulnar artery arises from the brachial artery as well. More distally, it is located on the ulnar volar side of the forearm and wrist. Both arteries are located outside of the carpal tunnel. In this overview, a transected carpal ligament can be seen, along with the median nerve which has been decompressed.